Good morning, everyone. Good morning, fellow young people. We are here for you. And I feel very young just like you. All right. Thank you, Chair. I'll move straight to my presentation. Okay, this is the next slide. Just like Chair mentioned, I'm here to present to you or share with you one of the interventions called Community HIV Intervention for Boys and Young Men or young boys. My name's Simonda Mubita. Just like she mentioned, I'm a behavior change specialist. And let me mention to you that around my work for the past 11 years, there's something that I chose to do, not only just for Zambia, but we need to look at interventions that are very sound, interventions that should look or bring change among us in our communities. And some of the interventions that I've worked on or to assist or provide leadership, one of them is the international interventions called the Joint Insect, focusing on SRH and HIV prevention. And now the local intervention called the Men's Lusaka, which I'm about to share with you. My session this morning looks like this. We are going to look at almost 5 or 6 items. So we'll look at the problem itself, description of the intervention that I'm going to talk to you, and also who attends, who participates in that INSACA or the intervention. And we'll also look at the activities that are conducted during that INSACA. And also share with you some of the accomplishments, the successes that we have recorded in implementing or using the approach INSACA. And I'm not also going not to shy to share with you some of the lessons learned in this intervention that I'm about to share with you. Now, the issue that we are facing, I'm pretty sure you agree with me, that engaging boys and young men in HIV the issue or the problem that we have, it's engaging the boys and young men in HIV programs. And this is an ongoing public health challenge. You will agree with me. And actually even at the end of this conference, you will see most of the presentations that are being made are targeting the young girls, the young women, leaving out the boys and men. If they are there, then definitely you find that they are very few, just like one which I'm presenting to you. There are also a few programs on HIV targeting boys and men directly. And most of those that we would see, maybe it's just indirect. So if this problem continues, then we are going to see an increase, just like my brother who left, my previous brother who made a presentation to you. We are going to see an increase of new HIV infections amongst the adolescent girls and young women. Not until we resolve this by engaging the boys and men in HIV programming. Now, how are we going to resolve this? Just like I mentioned, we need to identify, we need to use interventions or approaches that are accepted in our communities. So what I'm presenting to you is an approach called Men's INSACA. This Men's INSACA is a traditional learning system for boys and men in Zambia. I think our culture is not different with other countries. You have other platforms which are just targeting men alone. And when they target the men alone, they learn different kind of things when they sit on their own. So we had to get this approach. INSACA, it's a local name in Bemba, which brings the men together. And we had just to use that because it's something that is already there. And we need to utilize that. And what used to happen way back using the Men's INSACA, it brought the men together. It brought the boys together. And they were being taught different kind of topics in there. And of course, HIV wasn't one of them. But we thought if this approach worked so well, it was very effective in dealing or in raising some of the boys into responsible men, then we can also use this intervention or this approach in dealing with the problem that we have of HIV. This is a platform used for learning and discussing topics of great significance to life, focusing on SRH and HIV prevention. The intervention is an effective approach where boys and men share real-life experiences and learn from each other. In there, in the Lusaka, just like you see in there, I think in one of the photos, that's just a small demonstration and where men sit freely, and this is age appropriate, by the way. Who should attend this Lusaka? Every boy or man can attend the Lusaka. Just like I mentioned, it's also age appropriate. Boys and men are recruited from areas considered to be hotspot or high-risk areas. Now, just like I mentioned, you can reach out to many, but in the context of HIV, we need to know which are the hotspots. Where can we get these men? Where can we get these boys? I think it's very important in your programming. So that's one of the things that we look at. But anyone can attend. But we don't need to miss the target in this context. The boys and men are recruited by trained outreach workers who invites them to the Lusaka. Of course, when you go out, and one of the areas that I'll give an example, the hotspots or the high-risk areas, it's the bars and nightclubs where we did a demonstration from. Because we consider alcohol and HIV, they are related, and we don't need to miss out the targets from there. So we go out into these nightclubs, talk to the men. We don't conduct the Lusakas there at the nightclub, but we fish out the men from the nightclubs. Those are high-risk places that I'm talking about. Then, in their sober mind, of course, maybe you might reach out to 10,000. Out of 10,000, 6,000 or 2,000 who attend the Lusaka. That is really a plus, because then we are going to have a session with them. The Lusaka is held right in the community, facilitated by either traditional marriage counselors, trained community health workers, champions of change, agents of change. Allow me to talk about the champions of change, or the difference that is there between the champions of change and agents of change. The champions of change, these are men, these are boys, who they are role models. For example, in the Lusaka, during the sessions, we talk about reduction of sexual partners, which is a high risk. Now, someone who comes out open and says, well, what I've been doing is not right to my partner. Now I think I need to champion all this. Let me be a role model. That is the champions of change. Agents of change, it can be anyone who volunteers to also push the agenda to ensure that men participate into HIV programming. What else have we done in these Lusakas? Approved IEC materials and training guides have been used to conduct sessions with the boys and men. Let me mention to you that most of these interventions that we have, usually when we start, would want also to reinvent the wheel. But we believe that materials are already there. Or what we're doing, as long as these are materials that have been approved by the key stakeholders, then we use those materials as long as they are focusing on HIV. My brother was talking about the 1990, and I'm pretty sure the materials that they are using, these are approved materials. So we need to also look at the issue of reducing the cost to manage certain projects. Behavior change communication tools must be cost effective, and that's one of the elements that we need to focus on. And in this project, we didn't want to create or begin to develop materials in that area when we already have. And some of the materials were coming from the Ministry of Health. It has a lot of materials. And of course, as an institution, we also have our own guide that we have produced. And those are some of the materials that we've been using. Communities where the Lusaka has been implemented include, I think, some of the areas which include Shawama, Chilenje, Garden, Kavwata, Libala, and Matero. The activities that are conducted during the Lusaka, like I mentioned, we have sessions. These sessions, these are topics that are being discussed in the Lusaka. And most of these topics, like I mentioned, they are all focusing on sexual reproductive health and HIV prevention. Men talk about the condom use. This is the correct condom use, and one has to be consistent. They talk about relationships. They talk about many things that can be of beneficial to them. The men's health fair or men's fair, this is something that we came up when we realized that just conducting the session is not just enough. And this men's health fair is conducted on a quarterly basis every after 3 months. And during this period, we bring closer the health services to them. And let me also further continue to mention to you that we always ensure that these services that are being provided, they are free services. And these free services, they can be accessed from the health facilities and which are run by the government. Psychosocial support and counseling, linking boys and men to health services. There are certain services that cannot be provided there and then during the sessions or during the men's health fair. So this is where we link the men or boys to the health facilities to access art, to access VMMC. This is voluntary male circumcision. Accomplishment, we distributed quite a number of male condoms during our period. That is for a period of 2 years. 5,168 men referred to INSACA, of which 3,000 attended out of the 2,700. So the numbers were very high in there. 336.21 boys referred to the INSACA, and which 2,900 attended the INSACA. So more than the men. So interest, I think it's to the boys. Why? The parents who were attending, the adults who were attending, they had the interest to see the boys attending the INSACA. 133 INSACA sessions were planned. Afya Mzuri conducted 332, of which we have that high number, meaning that there's high demand to this. 583 men testing for HIV. Those are good numbers that we shouldn't ignore. I think those are quite a number of achievements in there. Out of the target, 150 men for circumcision, 74 men circumcised. What is this? These accomplishments tell us. When men know their HIV status, they are also contributing to the reduction of new HIV infections amongst the adolescent girls and the young men. We want to see the men reducing the number of sexual partners. If one had 7, they have to reduce to 1. If they haven't been using condoms, then they need to be using condoms consistently and correctly. That's the message that we are preaching. Those that do not know their HIV status, they should know their HIV status. Those that are not on ARVs, they should be on ART. That is the message that we are taking, and by that we are going to see reduction of new HIV infections amongst the target that we concentrate on, which are the girls and the young women. Allow me to talk about the lessons learned in terms of benefits. It attracts boys and men. Boys and men gain comprehensive knowledge. I think that's common sense. Boys and men have access to health services, just like I mentioned. This is very critical. Boys and men are exposed to positive attitudes towards HIV prevention. Boys and men learn about ways of reducing spread of HIV. That is our message. That's the word that we need to live. Limitation. There is high demand of these INSACAs. High demand of sessions. Community health workers are volunteers. Potentially high turnover. Consent to test for HIV for boys. That is a challenge that we've been facing, and these boys are saying, wow, it's my right. I think I'm a grown-up person. Why do I need a consent from my parents? So I think allow me to end here. I know I've been rushing, but I hope I have shared something that is able to provoke all of us in this meeting. Chair, I hand over to you.
All right, a round of applause.